The female reproductive system is truly remarkable. At its center are the uterus and ovaries. These organs play a crucial role in a woman's life. They are involved in menstruation, pregnancy, and hormone production. Understanding how they work is the first step. It helps us appreciate their importance. It also helps us notice when something might be wrong. We must pay close attention to these vital parts of our bodies. Reproductive health is a cornerstone of overall well-being. It is not just about the ability to have children, it affects a woman's daily life in many ways. Hormones produced by the ovaries influence mood and bone health. The health of the uterus can impact comfort and energy levels. Taking care of your reproductive health is taking care of your whole self. It deserves our attention and care throughout all stages of life. Sometimes these important organs can face challenges. Conditions can develop in the uterus or on the ovaries. This is more common than many people think. It is important to talk about these issues openly. There should be no shame or silence surrounding them. Many women experience these conditions. Sharing information and experiences can be very helpful. It helps us learn and support each other. Awareness is a powerful tool for health. When we know about potential problems, we are better prepared. We can recognize symptoms earlier. We can seek medical advice sooner. This essay will explore some common diseases of the uterus and ovaries. We want to provide clear information. This knowledge can empower you to take control of your health. Let's learn together about these conditions. Uterine fibroids are one common condition affecting the uterus. These are non-cancerous growths. They can grow inside the uterine walls, or they can grow on the outside of the uterus. Fibroids can vary greatly in size. Some are as small as a seed. Others can become as large as a grapefruit. Many women will develop fibroids during their lives. Often they cause no symptoms at all. Endometriosis is another condition we need to understand. This happens when tissue similar to the lining of the uterus grows elsewhere. This tissue can grow on the ovaries, it can grow on the fallopian tubes, it might even grow on other organs in the pelvis. This out-of-place tissue behaves like the uterine lining. It thickens and bleeds with each menstrual cycle. This can cause pain and inflammation. Ovarian cysts are also quite common. These are fluid-filled sacs that develop on or in an ovary. Most ovarian cysts are harmless and cause no discomfort. Many cysts form during the normal process of ovulation. These are called functional cysts. They usually disappear on their own within a few months. However, some types of cysts can cause problems if they grow large, or if they rupture or twist. These three conditions, fibroids, endometriosis, and ovarian cysts, are distinct. However, they all relate to the health of the uterus and ovaries. They can sometimes present with overlapping symptoms. This can make it tricky to know what is happening. Understanding each one helps in recognizing potential issues. It's important to know that effective treatments are available. Medical science has made great progress in these areas. Symptoms of uterine fibroids can vary widely. Some women experience very heavy menstrual bleeding. This can lead to anemia and fatigue. Others might feel pelvic pain or pressure. It can feel like a constant fullness in the lower abdomen. Frequent urination or constipation can also occur if fibroids press on the bladder or bowel. For many, these symptoms significantly impact their daily activities and quality of life, making simple tasks feel difficult. Endometriosis often causes significant pain. This pain is typically worse during menstrual periods, but it can also occur at other times. Pain during or after intercourse is another common symptom. Some women with endometriosis experience fertility problems. The condition can make it harder to become pregnant. The chronic pain can be debilitating. It can affect work, relationships, and emotional well-being. It's a condition that is often invisible to others. Ovarian cysts frequently do not cause any symptoms. They are often found during a routine pelvic exam or an ultrasound done for another reason. However, if a cyst becomes large, it might cause bloating. It could also cause a dull ache or sharp pain in the lower abdomen. If a cyst ruptures or causes the ovary to twist, ovarian torsion, it can lead to sudden, severe pain. This requires immediate medical attention to prevent complications. It is so important to listen to your body. Do not dismiss persistent pain or unusual changes. Heavy bleeding that disrupts your life is not normal. Severe pelvic pain is not something you just have to endure. These symptoms are your body's way of telling you something needs attention. Early detection often leads to more treatment options. It can also lead to better outcomes. Please speak to a doctor if you are concerned about any symptoms. Diagnosing these conditions usually starts with a discussion. Your doctor will ask about your symptoms and medical history. A pelvic exam is often the next step. This allows the doctor to feel for any abnormalities. An ultrasound scan is a very common and useful tool. It uses sound waves to create images of your uterus and ovaries. Sometimes an MRI may be needed for more detailed pictures. For endometriosis, a laparoscopy, a type of keyhole surgery, might be used for definitive diagnosis. Treatment options depend on the specific condition. They also depend on the severity of symptoms. Your age and future pregnancy plans are also important factors. For fibroids, options range from watchful waiting if symptoms are mild to medications that can reduce bleeding or shrink fibroids. Minimally invasive procedures can remove or destroy fibroids. In some cases, surgery like a myomectomy, fibroid removal, or hysterectomy, uterus removal, may be recommended. Each path is personalized. For endometriosis, treatment focuses on managing pain. It also aims to slow the growth of endometrial tissue. Pain relievers can help with discomfort. Hormone therapy like birth control pills can reduce or stop periods. This can lessen symptoms. Surgery to remove endometrial implants can be effective, especially for severe pain or fertility issues. For ovarian cysts, watchful waiting is common for benign cysts. Surgery might be needed for large, persistent, or painful cysts. There is much reason for hope. Medical science is constantly advancing. Researchers are working to understand these conditions better. They are developing new and improved treatments. There are more minimally invasive options than ever before. This means quicker recovery times for many women. Remember, you are not alone in this. Seeking medical advice is a sign of strength. Regular checkups and open communication with your doctor are key to managing your reproductive health